and welcome to Learn the Facts. Today we have special guest Dr. Taylor Brown-Wolfe, heroin expert. She will tell us everything there is to know about how the opiate drug works. Please welcome Dr. Taylor Brown-Wolfe. Hello and welcome. Our audience has submitted questions to the show about things they'd like to know about heroin.
Sounds great. What would they like to know?
Well, first off, what is the technical definition of heroin addiction?
Okay, so most people commonly don't know the difference between drug abuse and drug addiction. Drug abuse is when a person chooses to get high and knowingly chases the high. Drug addiction is to the point when an individual's choice is limited or taken away altogether because of their dependency to the drug. The National Institute on Drug Abuse defines heroin as a chronic relapsing brain disease that is characterized by compulsive drug seeking and use, despite harmful consequences. They consider drug abuse to be a brain disease because drugs change the way the brain functions and they change the form of the brain.
What are some causes of heroin addiction or addiction in general?
People start to abuse drugs out of curiosity, to try to fit in, and to try to overcome depression and pain. Heroin is also a relaxer drug, so some people use it to get off the high of other drugs, as in cocaine or meth.
Does the media play a role in heroin addiction?
Media does not play a role in heroin addiction. It is mostly caused by your surroundings growing up in your teenage and adolescent years.
Is heroin addiction passed genetically?
Yes and no. If a mother continues to abuse drugs through her pregnancy, the baby is not automatically going to be addicted to that drug or any other drug. The baby is then just more susceptible and prone to be addicted to a drug.
What are some short-term effects with heroin addiction?
There are many short-term effects, but most commonly you would feel a surge of euphoria or rush, and you would feel and see a warm flushing of the skin, and your mouth would be very dry.
What are some long-term effects associated with heroin addiction?
Long-term effects range from collapsed veins, infection of the heart lining and valves, and STIs as in HIV and AIDS or hepatitis B and C. STIs would be caused from sharing needles.
What are a few policies or laws that are associated with heroin use?
Well, first, if someone is caught with 7 or more grams of heroin, they will be charged with intent to sell and may face up to 30 years and or be charged up to $1 million. If a person is caught in a drug bust, if they're dealing, they may face up to 5 years and or be charged up to $100,000. And if someone is caught dealing to a minor and or on school property, they face up to 5 to 10 years and or $250,000 in charges.
Where in Burlington can someone go to get help, either for themselves or for someone they know?
There are many places in the greater Burlington area for addicts to seek help. There's the Lund Family Center, which they service adoptions, residential treatment for pregnant and parenting young women, and substance abuse recovery. Another place is the Champlain Drug and Alcohol Services. They service drug and alcohol rehabilitation.
When it comes to preventing and treating the disease, what are some good tips that you have for our audience?
Definitely knowing your facts and knowing how heroin will affect you. Avoid people who are involved with illegal substances such as heroin. And if you're a struggling addict or you know someone who wants to stop their addiction, to find help, to seek help, because taking the first step is the hardest step to take, and it will help motivate someone and encourage them to continue through the rehab process.
Well, thank you so much. That's all the questions that our audience submitted, but I have another question for you.
Of course.
What are, in your opinion, 3 most important or interesting facts that you want to share about heroin?
Well, it's definitely good to know that heroin is the fastest acting opiate when injected. So if you inject heroin, it reaches the brain within 7 to 8 seconds. Also, heroin almost always comes in a powder form, It mainly comes in white, but it can also come in pink, gray, brown, and black. Black is referred to as black tar heroin. Heroin can also come in a pill form, but very rarely does. And lastly, most drug dealers cut their bundles with some non-toxic substance, such as flour, to reduce the purity. And this way they actually sell less heroin and get more money for the purity of it. Many people overdose on heroin because they never know the purity of what they get. So when they go to take their usual hit, it could be more than they expect and they would overdose, or it could be less pure than their usual and they wouldn't get the surge that they're looking for.
Well, thank you again for being on our show.
You're welcome. Thank you, everyone.
Next on Learn the Facts, we will have Dr. Schneider, orthopedic expert.